When it comes to the topic of life-threatening diseases, most people will agree that the plan should be what is best for the patient. When this agreement ends, however, is on the question of whether aggressive treatment or comfort care is the better option. Many people assume that the first thing that should be done is to search for a life-saving treatment. By focusing on prolonging life, people overlook the deeper problem of promoting a higher quality of life. Comfort or palliative care, as defined by the World Health Organization, is an approach that improves the quality of life of patients and their families facing the problems associated with life-threatening illness. It provides relief from pain and enhances the patient's life. Comfort care facilities are also equipped to provide emotional and psychological care to help patients in any way possible. People choose to stop treatment and undergo solely palliative care for a variety of reasons. Some only choose it after they have exhausted all other options for treatments. Others choose it after discussion with doctors, when they decide not to go through the painful treatments if they are not sure they will work. But those who support aggressive treatment would certainly take issue with the argument that most medications or procedures cause pain without being entirely effective. While it is true that there have been some instances of experimental or new medicines saving lives, these are far outnumbered by the many times that such medicines only grant a few months more, and often at extreme cost. For example, patients requiring critical care in the intensive care unit may need to, at any point, have 4 different types of tubes and need to be attached to a respirator in order to breathe, yet still be kept alive. Sometimes these measures can be useful if the person's body can heal while he is in the ICU. The majority of the time, the patient is unable to heal fully while in these painful machines. In addition, many of the people who are being kept alive through ventilators and other devices can't respond or communicate but are in a great deal of pain. By forcing them to undergo treatment, their last moments are ones of agony that they cannot even change. In addition, studies show that people who seek palliative care can have less concerns about the ends of their lives. This is also the case for their families and other loved ones, who often find that knowing in advance and accepting the end makes the grieving process easier than an unexpected death in the middle of a painful treatment. Most comfort care facilities also provide psychological help to their patients and families to provide the best possible end-of-life care. Ultimately, what is at stake here is the peace and quality of life of your loved ones. In order to ensure happiness at the end of life, comfort care must be prioritized.